but I just want to level set a little bit because there have been people and communities suffering from addiction for decades that we were not paying attention to. And what happened is the opioid crisis brought that fire to the suburbs. And when white young people started to pass away, our perception of who we think becomes addicted started to change. And so that's when the country started to pay attention. And there's a history lesson in that. And so everything we do that has to be done with humility and honoring that history. And that's what we're looking to do at our foundation.
I would add to that, obviously, we've heard the reference to the crack epidemic and meth and people, cooking up meth. I remember being in Oregon, and there was an area that people just described as a meth row. The difference here is you cannot get a doctor to write a prescription for crack. And so this became a situation where we distrust doctors too. And I think that's what hits at a lot of people. And when we hear Dr. Johnson, someone like yourself, the research we trusted, and we went with the research, people obviously then say, well, if I can't trust my doctor to know, how do we know that the next pill won't be deceptive or the next bit of information? And we move from opioid to some other name we don't even know yet that is around the corner. So who do we trust?
And that's a fair criticism. And I would...
It's a question. I don't know.
And I would say that the medical industry has suffered credibility because of this. And the truth is rightly so. When I went back to investigate the research that said like these medicines were not addictive, I found that the research was laughable. That these studies were not done long-term on patients. No studies went longer than like 3 months. Most were like 6 weeks, and you're talking about treating someone chronically with these. And we have reached some turning point in the medical industry. We now have more mechanisms in place to track prescriptions. We have the monitoring databases so we can keep better track of them. We have new published guidelines in the state of Minnesota, for example. Doctors are now going to get report cards on their prescribing. Even I, for the first time, will get feedback on how many opioids I've written.
Will that be nationwide, though, or is this one state at a time?
I think it's one state at a time.
But we don't have the time. As we said,
right.
People are dying in the course of this show.
But I would still say there are other vulnerabilities still in the system that persist. Just this last January, in the Journal of the American Medical Association, researchers found if you look county by county in this country, if you want to see where the most overdoses are, find the pharmaceutical company gifts to doctors.
I think what you're highlighting, Tamron, is stigma. And I want to point out stigma in a couple of different ways because the guests that you've had today, they have the courage to put a face on addiction and overdose, and that's going to fight stigma, and that's what our country needs. But there's ongoing problems. Right now, even now, if you walk into most hospitals, a beautiful atrium, a beautiful building, and you walk in the hospital seeking mental health or addiction services, you're going to get sent to the back annex because you're going to get the implicit message that you're a second-class citizen with a second-class illness, and that's not right.
That's not right.
And here's the other thing. If we've learned anything from what we did with crack and the horrendous mistakes is that you have to invest in people. Addiction and overdoses are about people. Not about drugs. And we are just talking about drugs incessantly. And
you've said that if we had handled the crack epidemic right, if we'd handled meth right, we would not be here potentially with the opioid crisis.
That's right. And there's other drugs that are going to come down. And I have to say this as a child psychiatrist because families and young people, that's where I'm at in these communities. And there are young kids right now, millions of them, incubating in our schools. And instead of investing in prevention, we're talking about how to legislate around drugs. And that's not a sufficient answer.